High pressure.
It's easy when you see it.
Right.
Right there.
Also high stakes, talking about culture change as the anthropologist in the room. But I'll do my best to represent my people. I'm a cultural anthropologist. I work in the Department of Family Medicine at Virginia Commonwealth University. And most of my work is around practice transformation. It's around workforce innovation. It's around how do we make the pursuit of health a more humane experience. And I mean that both from the perspective of those who seek it, as well as the perspective of those who deliver it. So most of the comments I make today are based primarily on 4 data sets that I've been looking at for a while, so I wanted to just introduce you to them. One is Prescription for Health. It was a 5-year study of the Robert Wood Johnson Foundation. It happened before the Future of Nursing report came out, and it was about how do we get primary care practices to connect patients to resources to improve their health behaviors. I was on the evaluation team, so through that report, we had some fairly detailed information from 300 practices across the country. The other 3 data sets are after the report. The first is a planning grant, also from the Robert Wood Johnson Foundation, in which they asked me to identify a set of practices around the country that were innovative in terms of their workforce. I, for that, spoke with and emailed with about 800 primary care leaders. I ended up with a group of 350 practices, and I actually personally interviewed 250 of them by phone. Very happy with my earpiece. So there was that. The third has to do with a data set of over 600,000 comments made by diplomates from the American Board of Family Medicine as they've gone through their maintenance of certification process. And the fourth has to do with a recent hotspotting interprofessional student experience supported by the Camden Coalition, Primary Care Progress, and the AAMC. I was evaluating the experiences of students who participated in those hotspotting teams. The first round, there were about 60 of them, but it was a national spread. So with those things in mind, I've seen a lot of changes before and after this report. And I wanted to say that it has had an impact, and I've seen it. Mine is a world, unlike Geisinger or say the Minute Clinic, mine is a world of small primary care practices. They're the majority of practices around the country, and there are thousands of them. Mine is a world of small groups of people who have figured out how to make important changes and advancements in the health of the people they serve and the communities in which they're located. It's very important to me that when I look at the differences between what we find in the literature and what we find in frontline practices, that they are vast. I have seen the future nurses of which you speak. They're around. They are all out there. It may be just the start, but they are definitely there. I have seen them lead teams. I have seen them lead clinics. I have seen them work collaboratively, autonomously, professionally with other disciplines within their clinics. These things can happen. I have not seen them happen as a direct response to payment reform. I have not seen them happen as a direct response to the expansion of scope of work or state legislation. I've seen them happen as a response to practices that are interested in the wellness and the health of the patients they serve and the communities in which they're located. And I wanted to highlight that and spend the most amount of time on that because I think it's important that we all understand that we carry our environments with us wherever we go. That means that the patients bring into the clinic not just what's bothering them, but they bring their world experience. They bring their jobs, they bring their families, they bring the arguments they just had and the traffic they just went through. Likewise, the professionals bring their environments with them too. Their training has to be commensurate with the job they are trying to perform. And if their training only happens in academic settings or only happens in hospital settings, it does not meet the needs of the patients. I think there are very clear ways in which we can build upon, maintain, but also build upon the recommendations of the Future of Nursing report. We should take inspiration from these frontline practices and try to advance some of the models that they represent. Those models are plural. There is no one model. We are a population of over 3 million people. There can be no one model. We live in all kinds of areas. What we need to advance is the ability to see nursing as not a resource to the healthcare system, but as a profession. And as a profession, it needs autonomy. It needs to not support teams. It needs to author and lead teams. It needs to have ownership in the organizations in which it exists. It needs to have experience dealing with people in the areas in which they live, work, and play, if it is going to be enabled to meet the needs, the health needs and the health care needs in the areas which they live, work, and play. As a last comment, I just want to point to that language. We see a lot of rhetorical changes happening. It shouldn't be about the patient-centered home. It should be the person-centered home, or it shouldn't be about inclusion. It should be about integration. It should be about collaboration. These rhetorical shifts are interesting by themselves, but to me what they indicate is that we've not yet adopted the spirit in which those language changes are intended. And I think that that cultural shift is the one that we need to focus on.
Thank you. Superbly done, right on time. Thank you very much. Thomas Grass.